Good afternoon. Kanya, Matt, and I represent 3 different scientific disciplines, but we are all united under the One Health concept. This concept promotes transdisciplinary collaborations to identify innovative strategies that we can use to address complex global health challenges that all address human, animal, and the environmental health risks. As a fellow at the NASA Applied Sciences program, our team promotes the use of Earth observations, along with other data sources that we can use to be able to learn more and understand more about the dynamic processes of our planet Earth and the ecosystems where we live. As a scientist, I consider this part of our One Health toolkit. One example is air quality. By using NASA OMI data, we have been able to observe that over the last decade in the United States, air quality has actually improved. Due to reduced NOx emissions. This can be attributed to our strict environmental policy, the Clean Air Act, technological advances, as well as eco-friendly human behaviors. Another example is looking at forecasting harmful algal blooms along our Gulf Coast beaches. By using NASA data from the MODIS and VIIRS, as well as citizen science called the HABscope, we've been able to increase the accuracy and frequency of the reporting measures for harmful algal blooms along these beach communities.
So for the past year, I've worked at the World Bank to operationalize One Health, and specifically this means working with a project that's operating in 11 countries in West Africa to build surveillance, laboratory capacity, emergency preparedness, human resources, and institutional capacity to respond to disease across the human and animal health care sectors. In addition, I've worked with a couple of analytical projects. The first of these is looking at how risk for Rift Valley fever and Crimean Congo hemorrhagic fever, 2 viruses that infect both humans and livestock, may change under different climate scenarios. And this is in collaboration with partners in Senegal and England. The second of these is looking at how we might mitigate against the risk of the introduction of a new disease in Mauritania by introducing components of human resources and surveillance capacity in conjunction with water infrastructure and urban development projects in intermediate-sized cities in the country over the next 5 years.
My name is Matt. I've been working in the office of Congresswoman Sherry Bustos for the last year, so I helped write this letter to the secretaries of DHS and HHS about transparency in terms of how taxpayer dollars are being used at the border, at immigration, with immigration policies that the administration enacted, and some of those asks were about healthcare, both physical and mental. This is a letter from USDA to our boss, letting her know that after a push she led to the agency, that an agriculture research lab in the district would be authorized to hire 12 more scientists, and one of the biggest projects that lab operates is the efficient ethanol production, and a benefit of that research is freeing up antibiotics that we use in human and animal health. And this is a photo from when 4 Parkland students visited, and more than anything, more than any gun policy change, they wanted help engaging the community. And that's why there's 3 of us standing here, because we think that the best way to promote a One Health collaboration is through interdisciplinary collaboration. So thank you.